Let's talk about how to hold and manipulate an ultrasound transducer. Depending on what and where you're scanning will affect how you hold the probe. But no matter what you're doing, there are a few simple principles to keep in mind. First, you want to be able to have a good, comfortable grip on the probe. You want to be able to hold it as close to the probe face as you can, and be able to stabilize it with some part of your hands, fingers, or arm. And this will allow you the best fine control over the probe as you can get. And finally, you want to be able to maximize contact of the probe face to the patient to allow all the ultrasound energy to be transmitted into the patient and then to be received back by that probe. The pencil grip. Much like the name suggests, you're going to be holding the ultrasound probe much in the same way that you would hold a pen or a pencil. You're going to hold the probe in your dominant hand, supporting it with your ring and little finger. And you're able to use the palm surface of your hand, resting that against the patient to help stabilize the probe. And this will be a good general purpose way to hold a probe for most all scanning applications. Next, let's talk about the overhand grip. This is the grip that I would go to whenever I'm doing a sub-xiphoid image of the heart. What I'm trying to do is get my fingers out from underneath the probe, allowing me to get a very shallow angle against the skin to get that cardiac view. And I'll be holding the probe much sort of the same way that I would an IV catheter for an IV start. Thumb on one side of the probe, middle finger on the other, using my index finger as a point of stabilization and fulcrum point to get those fine movements to get that good cardiac view. Let's talk about the underhand grip. This is the grip that we would go to whenever we're scanning the lateral side of a patient, for example in a left or right arm quadrant view of a patient in a fast scan. And all we're doing is supporting the weight of the probe within our hand. The downside of this technique is we don't have a good way of stabilizing the probe against the patient, and that can make fine adjustments of the probe a little bit more difficult. This is what I'm calling the vascular grip. This will be the one time that you'll be holding the ultrasound probe in your non-dominant hand because you're trying to use your dominant hand for the fine manipulation of the IV catheter that is required. The other thing that will change here is the position of the probe indicator. This will be the one time that is based off your positioning versus the anatomy of the patient. For this case, we'll be holding the probe indicator off to our left, so as we're manipulating the IV catheter, if we turn the catheter to the left, we will see the needle on screen drift off to the left side of the screen. And vice versa, if we turn the catheter right, we'll see the needle on screen drift off to the right. Here we have the 5 ways that we're able to move the ultrasound probe in order to achieve the images that we want to obtain. We're going to have 2 gross movements and 3 fine movements. The 2 gross movements are going to be sliding and compression, with the 3 fine movements being tilting, rotating, and rocking. The one thing that we need to ensure, though, is that we're only moving in one plane or axis at a time. If we're trying to rotate the probe at the same time that we're sliding the probe, we're not going to know which movement that we made that improved that image. But if we isolate those movements where we're only tilting the probe or only rotating the probe, we're able to maximize our image in that plane or axis before moving on to the next one. Let's move forward and break down each of these movements. Sliding is going to be a large gross movement. You're going to be maintaining the overall orientation of the probe as you slide it up and down, left and right across the body in order to either find an object of interest or to track that object within the body. Compression is another gross movement of the ultrasound probe. What we're going to do in this case is maintain the overall orientation of the probe, and like the name suggests, we're going to apply pressure through the body of the probe. The most common use for this is to help differentiate between veins and arteries. Veins will completely collapse underneath pressure, while arteries will maintain some sort of circular structure to it and be pulsatile. Let's finish by talking about the fine movements that we can make using the ultrasound probe. The 3 primary movements that we can make are tilting, rotating, and rocking. For me, it's easiest to think about these movements in relation to the movements of an aircraft along its axis, where tilting will be related to pitch, rotation will be related to roll, and rocking will be related to yaw. Breaking down those movements even further, tilting will be movement of the probe along its x-axis. Roll or rotation will be movement along its z-axis. And rocking will be movement along its y-axis. Now, yet again, the most important thing to remember whenever you're moving the ultrasound probe is try to only move the probe in one of these axes at a time.